Do you have any idea how much a pharmacist in Canada can make? Pharmacists are one of the most respected healthcare professionals in Canada, and on Bounce Back in Life channel, that's what we are going to discuss today. The scope of pharmacy, what are the different jobs that pharmacists can do, and what is the salary that you get. I welcome you to today's video. My name is Gagandeep Kaur and I work as a pharmacy manager. I once came as an international student to Canada. I'm currently working in British Columbia. I have worked as a pharmacist and pharmacy manager in Saskatchewan, Alberta, and now in British Columbia. Make sure you subscribe to Bounce Back in Life channel if you haven't yet. Share it with friends and family who will find the content of this channel useful. On this channel, we talk all about how you can bounce back in your life. We talk about the immigrant life, international students, what is the scope, part-time jobs, full-time job, and currently we are doing the series on pharmacy perspective and pharmacy scope in Canada. We also do motivational videos on this channel to keep you motivated. So what are you waiting for? Get ready to bounce back in life. Let's go. Now coming back to today's topic, we will first discuss what are different job perspective of a pharmacist, and then we will talk about the juicy part about salaries. There is a lot of different opportunities for a pharmacist in Canada. Starting first with the community pharmacy, the role I am currently in, I work as a pharmacy manager, but you can work as a pharmacist, you can also work as a relief pharmacist. I will explain this term later. So first job prospect is the community pharmacy. Second job prospect is working in hospital pharmacy. There is one additional requirement if you want to work as a hospital pharmacist, and that is doing a residency in hospital. Usually it lasts about a year or 2 years depending on which province and which hospital you are doing your residency. During your residency, you are paid about half the job of a full pharmacist. After you complete your residency and you're a full hospital pharmacist, then you're paid the full wage. The third prospect is working with the drug plan. So every province in Canada has different drug coverages for all the residents. In order to get your medication coverage, there is certain criteria that need to be met when your coverage from government starts. So government needs pharmacists to decide those criteria based on which medication to be tried first, and after trying a second medication, then the coverage of third medication start. So those are the pharmacists who work with the drug plan in different provinces to decide the criteria of coverage of certain medication, especially the ones which are costly medications in Canada. In order to get those ones covered, there are certain criteria you need to meet before you get the coverage from the government. That is another job prospect of pharmacist, and that is an office job. Fourth job prospect of pharmacist in Canada is working in pharmaceutical industries. Pharmaceutical industries do need registered licensed pharmacists to run the clinical aspects of the drug inventions and drug alternatives. That is another job aspect of a pharmacist in Canada. Another prospect that we're going to talk about is working with regulatory affairs. So the regulatory bodies that make policies and procedure for the pharmacist and pharmacy practice also need licensed pharmacists to work with them. One of example of a regulatory body that we discussed in last video was NAPRA. Those regulatory bodies also need licensed pharmacists on their team. Next job prospect that we are going to talk about is organizational roles. As mentioned in the previous video too, every province in Canada has their own college of pharmacy that issues you license, and also each province has their own pharmacy association. For example, College of Pharmacists of British Columbia, CPBC, is the college that issues license to the pharmacists, pharmacy technicians, and pharmacies. Plus there is BC Pharmacy Association, BCPHA, that is the organization that supports pharmacy growth and education. So these organizations also need pharmacists on their teams. Next job prospect that we are going to discuss is long-term care facilities. Pharmacists who have geriatric certification and are specialized in medication dispense to elderly population work as long-term care pharmacists working in long-term care facilities and other care homes. Another job prospect for a pharmacist is travel, health, and medication. Travel health has been on a little bit halt due to pandemic as people are not traveling, but it is a great scope of practice for a pharmacist. You need to be certified as a travel health pharmacist in order to provide consultations to people who are traveling out of the country, who need additional medication and vaccination for their safe and prevention of certain diseases. CTH is the certification that is required to work as a travel health pharmacist. You can work in a pharmacy as travel health pharmacist, or you can work in a travel clinic. Next job prospect, exciting one that we're going to talk about, is military pharmacist. Yes, you can work as a military pharmacist in Canadian Armed Forces, dispensing medication and providing medical advice to the military forces. And the last job prospect that we are going to discuss that has emerged after this pandemic is working with public health as an immunizer. There are a lot of pharmacists that are being employed by the public health authorities and Ministry of Health all over Canada for immunizing Canadian residents against COVID-19. Now, after discussing all the job prospects, we are going to talk about the juicy part, that is the pay of pharmacists in Canada. Now, before I tell you the number, I want you to know that there are certain factors on which a pay of pharmacists depend. First factor on the list is location. You might be surprised to know, but based on the location where you're working, there is huge difference in the pay that you get. Depending if you're working in a bigger city where the availability of pharmacists is lot, because most people want to live in bigger cities, the wage scale go down compared to if you're working in a small town where the availability of pharmacists is less, then the wage goes up. Next factor that contribute towards your wage is the responsibilities. Working as a pharmacist gets you less wage compared to working as a pharmacy manager. As your responsibility increase, your wage increase too. Next factor that contributes towards your wage is experience. Depending on how many years of experience and what kind of experience you have, you might be given a higher package compared to the one who doesn't have that much experience. Next factor that contributes towards your wage is which setting you're working in. Depending if you're working in a community pharmacy that just service the community, the wage might be less. If the pharmacy is serving long-term care facilities and they have long-term care home contracts, then you might be offered a higher wage. Again, depending on how much responsibility will be given to you, your wage will increase according to that. And the last and most important factor that contributes towards your wage is your negotiation skills. Yes, I am not even kidding. It depends on you when you go for interview, how you negotiate your skills for the wage and package you can get. We are going to talk about negotiation skills on this channel, and I'm going to teach you all the tips and tricks that gets you a higher package. Now, we have discussed all the factors. Coming to the numbers. Numbers vary a lot for the wage of pharmacist. You could be starting at a wage of $32 per hour depending if you're working in a bigger city, or you could be starting at a wage of $55. You could be earning up to $85 per hour. There is not set maximum limit. Considering all the factors that we have discussed earlier, pharmacist wage average from 32 to 85 to even 95 depending on certain conditions. So that's all about the scope of pharmacy. If you have not subscribed to Bounce Back in Life yet, make sure you subscribe to the channel, share it with friends and family who would find the content useful, and I will see you in the next video. Until next time, stay motivated to live your best life and get ready to bounce back in life. See you.